But what about the issue of brain drain? This has made the topic and still remains the topic. Just about last week, we did hear some health professionals asking the government to increase issues around welfare so we would curb brain drain. And it doesn't start today. It doesn't start with this administration. Of course, we do know that it's a general perception that brain drain is a major challenge for the health sector in Nigeria. The Japa syndrome affects the ICT, but also has been greatly felt in the health sector, and some of the complaints are poor working condition, low salaries and inadequate compensation, lack of career development opportunities, push and pull factors, and even some have complained about the lack of equipment, the needed equipment for these professionals to use on patients. But let's find out perhaps, as Professor Joseph Waja was so optimistic there, if there are lights that have been coming from different aspects also in this. We have to discuss this, the Chief Executive Officer of Medical and Dental Council of Nigeria, Dr. Fatima Kiari, also from our Abuja studio. Dr. Kiari, good morning and welcome to the program.
Good morning. Thank you for having me.
Great. So,
yes, the MDCN actually recognizes that brain drain is a big issue and contributes to significant challenges of Nigeria's healthcare system. At this junction, I'd like to say that this is quite aligned with the National Strategy for Health Renewal Investment initiatives, which is configured by the Honorable Coordinating Minister of Health, Professor Muhammad Ali Pate, whom I must say thank you very much for coordinating all issues around health workforce mobility. And we have the new Nigeria National Health Workforce Migration Policy, which really considers what we can all do. It's in alignment with the vision of Mr. President. And one of the things that we can do at MDCN, you know, is the regulatory body for medical and dental practitioners, and it was established through an act, the Medical and Dental Practitioners Act. And going by that act, we are to register medical doctors and dental surgeons. And how they get onto the register is actually our business. We regulate and approve the courses they do, that is medicine and dentistry, the qualification they get, which is MBBS or its equivalent, and BDS, and even the institutions, that is the universities that offer these courses. Now, what are we doing in alignment with the vision of the President and the 4-point agenda of the Honorable Coordinating Minister of Health? Our first strategy at MDCN is expansion of medical schools. Why do I say expansion? In terms of numbers, when you look at the numbers we have produced in the last year, our output is about 5,500 of medical doctors. And you compare with the number in 2024 of those that have exited, it's about 4,000. So we have a net of just 1,000 in 2024 in terms of output, you know, new output and exit. Currently, we have about 116,000 doctors on the register. Of course, we have, not all of them are in Nigeria. We have an exit register as well. Some are deceased, so we don't count them, and some have exited the register. But if you look at the balance in the numbers, then that means we're getting more out than getting in. So one strategy is expansion of medical schools, a strategic expansion of medical schools in terms of numbers. And how do we plan to do it? Well, first of all, you must really recognize that our doctors are well sought out after. If anything, the brain drain, which is really negative to our population, but it's also a good indication that our training of doctors is excellent. They're well sought out after. And those that have gone out for so long, they have shown resilience, they have shown they're hardworking, they have depth of knowledge, and these are things that are sought out for doctors. And our doctors out there, you know, have excelled in that manner. So there's a pull factor. MDCN is not really an economic institution, so I can't really say much about the push factors, but what we are doing, as I mentioned, expansion. The president has given his vision. The minister has given his direction, is a directive. But we at MDCN must ensure that the increase in numbers is in alignment with our quality and our standards. And that is what we're doing. We ensure that we verify the schools that express their ability to increase the numbers. We ensure that they have the right infrastructure, the human resource capacity, and we're also supporting all the schools to have an effective delivery of the curriculum. So I would like to bring in the TET Fund high impact intervention initiated by the Honorable Minister for Education, who also has aligned with this vision of expansion. And we are going to collaborate with them. I'm in the coordinating committee, the ministerial committee for infrastructure development in selected medical schools, and not just for the study of medicine and dentistry, but also other health profession education like nursing and midwifery and pharmacy. So these are the things that it's a good time because we are all aligned in the same direction, and there's workforce mobility awareness. So these are some of the things that we're doing. We're also doing advocacy. So we are talking to World Bank in terms of the projects that we're going to do so that they can support this program of expansion. And we will continue to ensure that the quality is maintained, the high standards of training is maintained, but the output is increased. I'll give you an example. At the end of 2023, the output was the quota or resource-based carrying capacity of our medical colleges was 5,500 across 43 training institutions. And the need is great. At the end of 2024, with an active move and having a conscious effect of that vision, we have increased the number of training institutions to 69. I beg your pardon, to 65, and the output or resource-based carrying capacity now is about 7,500, and this is just the beginning of 2025. We still have a number of universities that have expressed the interest to train medical doctors, and we are going to be looking at them with a view to ensuring or supporting them to do that. If you look at the JAMB admissions, for every school, maybe we have a carrying capacity of 50 to start with, and some up to 150. But there are over 3,000 or up to 5,000 in some colleges that want to study medicine, for the space of that 100 or 150. So the need is there. The need is there. So what we need to do is to expand our capacity so that we can take in more. And then we have the population as well. I feel it's not just about, producing doctors to service the in-country needs, but I think with time, we can also produce more doctors to service even, the world. We can't do anything much about health workforce mobility at this point, but I believe that the destination countries also have a role to play. Support the source countries to expand their training capability and their capacity. Let's bring this discussion on the table, and let's make sure that destination countries also be aware. Let's have a managed migration system. I know this is a high high-level political engagement and discussion, but at MDCN, I think we can drive that and we can have advocacy around that discussion.
All right, Dr. Kiari, so this conversation you're talking about, I wanted to ask if you're having them, directly and consistently with institutions, but I learned you're also bringing in some international experts and stakeholders in the health sector. I guess this will top your conversation at your events.
Yes, so fortunately, yes, I've been talking to institutions, our training institutions, as I mentioned to you earlier. We are directly in connection with them because the Medical and Dental Practitioner Act actually mandates us to have that conversation with them. We regulate them, we regulate the training, and we regulate the curriculum delivery. So we have that discussion both with the universities as well as the clinical sites, which is the chief medical directors. Of course, some of them, showed some apprehension at the beginning because of lack of resources, but we are looking at that directly. We're looking at advocacy for infrastructural development. And we're going to have a workshop in the coming week, which is the Association of Medical Councils of Africa workshop, and the aim of the workshop really is to have an isomorphism. Let's talk to each other. What are we all doing about it? And the key theme is integrated health regulation and leadership in developing health resilience, health systems resilience. And we are bringing almost all the stakeholders to the table. We're going to have a conversation. The Honorable Coordinating Minister of Health has invited ambassadors of destination countries. Out of the 4,000 that have exited due to health workforce mobility, about 60% of them go to the UK. Okay, let me just say about 80% of them go to the United Kingdom and the United States. And then about 10 to 15% go to Europe, and then the rest go to other countries. So we need to bring destination countries to the table, and we're having that conversation. The Honorable Coordinating Minister of Health, Professor Mohammed Ali Pate, has graciously actually invited them, and we hope that they will be there to listen to us, and we're going to be talking. We have a whole session on workforce mobility, not just what is the issue or why they are or what our retention strategies are, because we really need to also support those that remain. Those that remain are very key and important, so we need to support those that remain. And we also need to talk about how we can track. So as we said, it's a free world, you move, but let's be able to track and let's be able to see what we can bring back to our country. Apart from supporting those who remain, we're also having a reintegration strategy. So we have started to talk with associations of Nigerian practitioners in countries across the world, and we're asking them, we're making re-registration or reintegration much easier. They're integrating back, and we're also leveraging on digital health tools so that we can, get their input, even if it's through digital health. We have actually almost finalized our digital health guidelines, and this is the mandate of MDCN again, and we will soon have that, because that would really make things a lot easier, both for doctors that remain and for doctors who we wish to reintegrate from other countries. So the discussion is being had on the table. World Bank is also supporting, and we have had a lot of discussion with World Bank, and they're going to also have a session on discussion of migration policy, the migration policy, in the workshop that we're going to have next week. So the discussion is ongoing.
All right.
And the advocacy will continue to grow.
All right, Dr. Fatima Kiari, the Chief Executive Officer of Medical and Dental Council of Nigeria, wish you the best.
Thank you.